Okay, everyone. I think we're going to go ahead and get started with the next session. If everyone can make their way to their seats. All right. So welcome, everyone, and thank you to our four presenters for the first Day One Idea Showcase session. So for people new to the partners meeting, these are like lightning fast, rapid overviews of some of our different partners' work and a chance for them to show what they've been working on. So each partner will get 5 minutes to present their slides, and then we'll have about 10 minutes or so for audience Q&A at the end. And our four speakers today are Noah Urban from our lovely host, Data Driven Detroit, who will be giving an intro to the city of Detroit and some of the neighborhood tours that we'll be doing. And from our newest partner, the Community Innovation and Action Center from UMSL, the University of Missouri St. Louis, Paul Sorensen, who will be doing an overview of their work and how they got to this point. And Jeff Williams from the Johnson Center for Philanthropy in Grand Rapids will be doing their project on community health data. And Shannon Carter from Data Haven in New Haven will be doing an overview of their project on the intersection of LGBTQ plus race and ethnicity in data. So I'll hand it over to Noah.
Okay, and are you going to press play or? Okay. All right. Well, guess everyone gets to hear from me again. I'm Noah Urban, co-executive director of D3, and I have the unenviable task of trying to cram as much context about Detroit into 5 minutes with rapidly advancing slides as humanly possible. So we'll go ahead and get started. So just to give a quick overview of the city, Detroit is 139 square miles, has been around since 1701, so it's actually older than 300 years. And it has a very long and complicated history that we do not have time to talk a lot about today, so I'm going to be doing the best to give you a sense of the general demographics, population trends. The first thing to know about Detroit is that it's situated in what is a very large, very sprawling metropolitan region. The city there is highlighted in blue. You can see it actually encompasses, at the largest definition, 10 additional counties, several large satellite cities, and 3 counties in Canada. So there's a lot of space here, but we also live in a place that's very constrained municipally. So Detroit's population has actually peaked in the 1950s at about 1.8 to 2 million people, and then ever since then has been in a decline. Similarly, the 7 county suburbs have actually increased in that time before they leveled off in 1980 or so. So what this, or 1980, and haven't really increased in population since then. So what this means is that a lot of the population shifts in the region have come at Detroit's expense. This is the population density of the city in 1950 at its peak. And in a couple of minutes, you will get to see the population density of the city in 2010 using the same charts. So you can see there's been a massive hollowing out of density, especially around the urban core, but also into some of the outlying neighborhoods. And this has kind of been a very consistent trend. It slowed somewhat over the past census, but it's still very much present. There's also a lot of institutionalized segregation in the region as well because of the firm municipal boundaries. So this one is showing predominant race and ethnicity in the region, and you can see it's starting to break down a little bit as of 2020, but that 8-mile line along the top of Detroit is still very noticeable. And so there's still a lot of racial and ethnic segregation here. This map is showing kind of how that starts to break down, where you have Black, Hispanic populations moving more out into the inner ring suburbs, but again, still very noticeable patterns of segregation across the region. So that's kind of the very depressing demographic context in which the city exists. There are some positive trends as well. This is showing the population increase as of the 2020 census, and anything that's light blue or orange is actually increasing in population from 2010 to 2020. Seems like damning with faint praise, but if you think about 2000 to 2010, there was actually only 1 census tract that had a positive increase. So we are starting to see some more positive trends across the city. Now I'll switch gears and talk about the neighborhood tours for a little bit. So most of the tours are going to take place in some of those inner ring neighborhoods where you saw some of the more larger effects of the depopulation. And we're going to look at a few different areas or components of that. So the first one is the Hamtramck walking tour. This is actually touring one of Detroit's donut hole cities. These were two cities that exist entirely within the boundaries of Detroit. Hamtramck is an immigrant enclave. Polish, Bengali, Bangladeshi, Yemeni, there's a lot of immigrants in there, and this is actually a city that has managed to hold on to its density when a lot of the surrounding neighborhoods and the other donut hole city have very much not. The East Ferry Warren Greenway tour is going to take place in an area that's normally highly vacant and has been converted into green space and has a lot of programs that transform abandoned lots, and so looking at a lot of like vacant lot reutilization, stormwater management, things like that. North End and Milwaukee Junction is an area that's kind of just north of Midtown, which has been rapidly redeveloping, and this area is starting to redevelop as well. And so there's a lot you'll learn about here in terms of like food access, land use and vacancy, redevelopment, and co-op and co-op-owned businesses. The Brilliant Detroit tour will focus more on using creative use of housing stock. That focuses on building like early childhood focused neighborhood hubs in communities, and this is a model that's actually starting to launch into other cities as well as under the Brilliant Cities Initiative, so maybe a preview of coming attractions for your city as well. And then finally there's the Eastern Market Tour, which will look at one of the nation's oldest operating farmers markets. This is just to the northeast of downtown, and you can see lots of Detroit's kind of design character in that area, and then it's also starting to revitalize as some of the energy from downtown spills over. So whichever tour you want to pick, go ahead and sign up for it, as the spots are limited, and thank you.
Great. This is a fun hazing for our first official meeting. Cool. I'm Paul Sorensen. I'm a co-director of UMSL's Community Innovation Action Center. We're the newest official NNIP partner, but this is my third meeting. And really excited to follow in the footsteps of Eleanor Tutt and John Cruz and Rise Community Development, all of whom have done great in the STL data space. I often joke with folks that I can only give you an elevator pitch if we're like stuck on an elevator for half an hour and there's a whiteboard for some reason and we can like draw diagrams and figure it out. But I think like this is the best we got, so I'll give a little bit of an overview of what we do. So in 2017, 2018, we were presented with a data space that looked like this. There were like people doing different things. Maybe it looked a little organized, but it was very disconnected. Dashboards, resource sharing, strategy, where do we go? So we formed something called the St. Louis Regional Data Alliance, inspired by an NNIP partner out of San Antonio, the Alamo Regional Data Alliance. We thought our name was going to be temporary. It wasn't, but we brought 400 or so people together. We also ended up building an open data portal, the St. Louis Regional Data Exchange, again, modeled on the work out of Pittsburgh, the WPRDC, bringing St. Louis data together. And it was good work. We were getting a lot of progress, and then 2020 happened. And all of a sudden, the stuff that we were doing to connect housing and health and education went from being hypothetical, like, oh, that seems like a good idea, to a real pressing need in our region. And so our work got a lot bigger. And we really sort of embraced our home at the University of Missouri-St. Louis. And now we have 23 active projects, around 15 full-time folks, not everyone doing data exclusively, but a lot of people touching data in some way, shape, or form, including these fine folks. This is just a sample of our like core data team, working on health data, working on vacancy, working on qualitative data, working on operational data sets, really excited to have our team at the table. So I wanted to give just a little bit of what we're working on now. So we work closely with the City of St. Louis and the St. Louis Vacancy Collaborative, and have developed STL vacancy tools, which is a way to sort of discover what lots are vacant and what people are doing about them. We also, a couple years ago, did a home repair study in the city of St. Louis, measuring home repair with older adults, home repair needs with older adults in particular, racial disparities, and trying to understand where do we go from here. We also do a little bit of data work nationally. This is with the Children's Funding Project, trying to track youth data in states across the country, and really trying to figure out how to bring that to Missouri and St. Louis, which we're getting there. And also trying to think about the St. Louis nonprofit sector, how we compare it to other cities, and also just how hard it is to get nonprofit data of any quality or regularity, because it's so proprietary and sort of behind the scenes. So working a lot with those partners. Also working a lot with United Way 211, we're the data backbone for the St. Louis Community Information Exchange. We're really trying to figure out calls for service data locally and otherwise, and how they connect to other health and social service referrals. And for like the super nerds in the room who want to read a 30-page white paper about how data should fit together across health and social services, we've been doing a lot of work with CIEs, and happy to talk a little bit more about that too. One of the things I'm really excited about is we've also began to transition into the space of building data systems for people. So this is something that we built with a local initiative, doing some rapid rehousing. A bunch of folks were unhoused overnight, and we tried to figure out how do we build a data system that connect the dots. We've also started partnering very closely with our friends at Washington University on data for social impact, where all of our community-based work is going, and some of you have also participated in that effort as well. So what is the future? AI-driven, I guess, like around, the prompt of hundreds of neighborhood dogs made up of neighborhood data, wearing blue hats. Where do we go from here? It's a future we're really excited to embrace with you all. So we're thinking quite a bit about qualitative data, storytelling, experiential data, and how do we build tools that can effectively center people, but also make sure that we're able to tie data and link what's happening between someone's experience of vacancy and how vacancy is impacting the region. And ultimately, and I'm really excited to hear from all of you throughout the conference, how do we curate local data for community action? And what other information needs to be tied to data sets to make that work? So what we're thinking about now is how do we do everything brick by brick? How can we work with folks across the St. Louis region and make sure that everyone can benefit based on the work that's come before, and trying to, push St. Louis and this space forward. So thank you.
Suddenly, I now want a data dog. It just looked like fantastic. Jeff Williams with the Johnson Center for Philanthropy, here with my colleagues Tricia Ballo and Emily Jex. And we're here to celebrate a county that took a risk, a county health department and a county that used a very different approach for a community health needs assessment. So I'm not going to show you the results, but today I'm going to take you behind the scenes. So the process and procedure used to generate a fantastic result for the community in Grand Rapids, Michigan, so west side of the state. Very quickly, community health needs assessment conducted every 3 years, part of the ACHA, tied in with community health improvement programs. All of the hospital systems in Grand Rapids do collaborate, so this is a very collaborative thing. And it really, they have the phrase is the data you collect impacts the action you take. So a very community-oriented kind of data foot forward, but they were frustrated. 71 question survey, including 16 demographic questions. I didn't know you had that many demographics. Different questions every time, different modules every time. They couldn't compare things across the years. And a lot of tension. They felt they were getting to the same people every year. This is one of the problems. Gray bars are the actual demographics of Kent County. Blue dots are their convenience sample. And you can see that the two do not align. They were not getting a good representative sample. So between the frustrations of too long of a survey, too many questions, not getting the same people, they decided to change. 3 big factors. They went to a multi-mode survey. They leveraged existing partnerships, and they really put a foot forward with community-led outreach. And that's what we're going to spend the rest of our time together talking about. Multi-mode surveys, multi-samples. We fielded 3 different surveys. We did a telephone and web random sample. Why? Because it's a random sample. It's representative. We could use that as the baseline and benchmark. We kept the convenience samples because they're convenient. They're cheap. They're easy. They're also incredibly biased. But the community liked them, so we kept them, but then we went to a targeted sample. This is bias in the way we wanted. There were some populations we wanted to reach. How did we know? The health department had convened community councils 18 months prior to the surveys hitting the field. They built up community goodwill and community trust for a year and a half before they engaged the survey process. Those same partners then, when it came time for the community level outreach, were willing partners. 5 big risks the health department took, and we are the vendor that responded to the RFP. We'll go through each of these a little slowly. The biggest started with compensation. The health department put onto the table 12 $2,000 grants to community organizations to help distribute the survey. $2,000 stipends with no strings attached. The community could decide how to use these stipends. 12 different community organizations stepped up and helped distribute those surveys to the community and the targeted samples while we were doing the representative sample. Surveys in multiple languages we fielded from the official website in English and Spanish. Some community partners translated those into 4 additional languages, handed them out on paper, then worked with their communities to enter that data on the public website to broaden the reach of that survey. We also, knowing that we're engaging community partners, we made their graphics and communications lives easier. We gave them a social media toolkit, pre-packaged graphics to help them communicate the importance of the community health needs assessment out to their populations in both English and Spanish. They then adapted these graphics into the other 4 languages. But wait, that's not all. We said to each of the 12 partners, if you get at least 50 people to take your survey, we will hand you back your community's answers. Not a crosstab in the major report, a separate standalone report of your members or your community members in addition to the big report that goes out. What were some of the examples? What did those community partners do? Here's just a sample list of all the different ways that they chose to engage their communities. Remember, no strings attached to the money other than you have to do at least 3 activities, but you define the activities. So a huge example of community outreach and community trust, trust-based philanthropy from the county government. So a great celebration of government taking a good risk. What were the results? Bottom in green, that was the last time they did CH&A. Top in orange, this time. Twice as many respondents in 3 fewer weeks of fielding. And let's look at that original chart. Here we're going to see the demographics. How'd we do? Same thing. Gray bars are the Kent County population. Blue dots are the last round. Orange dots is this round. Notice many more of those orange dots are much closer to the gray. We got a much more demographically representative sample. And where the orange dots are above the gray, those were populations we wanted to oversample. We wanted intentional bias to get at some of these traditionally underrepresented populations. A really quick tour through the behind the scenes of a survey, and again, a great risk from the health department in taking some risks and implemented by an NNIP partner. Thank you.
Okay. Hello, everybody. I don't know if the slides, no. I'm gonna wait so that I'm timed. Okay. Hi, everybody. My name is Shannon Carter. I am with Data Haven. I'm on 3 hours of sleep, so please forgive me if I mess this up. We're going to look at the intersection of queer identity, race, and ethnicity data in Connecticut using some results from the Household Pulse Survey and some other data sets, which I will go over in just a second. Perfect. Also looking a little bit at Data Haven's Community Wellbeing Survey, some data from the CT Commission on Human Rights and Opportunities, and then some select quotes from some qualitative interviews, which from a project that we wrapped up a little bit earlier this year. Speaking too quickly. Okay, quick terminology. LGBTQIA+ is going to be the umbrella term that we're using. Transgender and cisgender are used as sister terms here, queer and straight. And then for this project, we use the term Latine as a gender-neutral version of the term Latino, just in keeping with the gender diversity, specifically trans folks' preferences. All right, so during the 21 to 2023, there was a markedly higher rate of loss of household income for Black and Latina-headed households. This is a little bit higher for the LGBTQ households, but just generally elevated for Black and Latina households. But then on the next slide, we'll see food insecurity specifically was significantly higher, specifically among LGBTQ Black and Latina households. Yes, and this is not having enough food in the past 7 days specifically. I think I'm talking much faster than in my practice presentations. Another aspect of this that is important to understand is that Black and Latina households are more likely to be renters in general. This opens folks up to all sorts of discrimination in the rental market and general higher levels of financial precarity, which is important for some of the other stuff we're going to talk about. And then another notable fact was just that LGBTQ people in general were overall more likely to be depressed and or anxious. And for this specific stat, we didn't see the same elevated rates specifically for Black and Latino folks. It was kind of just the community as a whole, which is also something to keep in mind. Some frameworks that can help contextualize some of this data and ongoing conversation as we get more disaggregated data is the historic and ongoing context of legal and social systems, specifically discrimination and racism built into the law, intersectionality, and then stigma and minority stress theory can get at some of the pathways. This quote, it might not be enough time to read the whole thing, but it was a community member talking about how Black queer folks specifically felt alienated from both Black and queer communities, while at the same time being at higher risk of violence from outside communities, kind of putting them in this middle ground. And again, here we don't have the disaggregated data, but speaking a little bit about discrimination specifically, both for sexual orientation and gender identity, discrimination is most often occurring in employment settings, although with gender identity, we do see higher reports of discrimination to the CHRO in public accommodations. And this is just a little bit of information about what that data looks like. So gender identity discrimination complaints started to be collected about 10 years ago. We've seen that go up, and sexual orientation complaints have been collected since the early 2000s, and they've remained fairly steady, some valleys. This is from the Community Wellbeing Survey, looking at, and again, not disaggregated by race as well, but looking at discrimination across employment, healthcare, and dealing with police. And we can see that trans folks specifically have pretty high rates, as well as lesbian or gay or bisexual folks as compared to cisgender or straight folks. And this is just another quote from a community member talking about how, for example, a queer undocumented person needs to be receiving services in a community that is understanding them as both a queer and undocumented person and not one or the other. And that sort of gets into what we can do with this information as it is improving and more available. So approaching folks as the whole person, avoiding a one-size-fits-all approach, and also understanding that gains for the LGBTQ community as a whole are not distributed evenly. One thing that came up a lot was gay marriage or marriage equality. A lot of community members felt that that didn't really benefit them when they were dealing with violence in their community. This is my contact information, the report, if anyone wants to look at more, and feel free to chat with me about it. And I've got a couple seconds.
All right, thank you to all four of our presenters. I think that is definitely one of the smoother idea showcase sessions I've seen, so props to them. And now we'll take Q&A from the audience.
I guess this is a question for Noah. The Brilliant Detroit, is that what the Reverend this morning was referring to with the populations that?
Not quite.
Oh.
Separate but somewhat related programs. Yes.
To the Hartford team, Shannon, right? Hi. In the qualitative interviews, were there any insights to cultural differences for stigma on the LGBTQ community that you can talk about, if there's something came up about that, especially with the Latino community?
Is this on? Okay, cool. I missed the very first part of your question, fiddling with the microphone. Could you repeat it?
I was asking your name, but no, I'm kidding.
After that part.
If there was any, in the qualitative interviews, any information that came up about cultural differences or views that affected the LGBTQ experiences, especially in the Latina community?
Not in this particular round of interviews, though that is something that I would like to explore in the future.
A question for Paul. When you, we've looked at the nonprofit sector through 990 data, and it kind of sucks because it just tells you pretty high-level stuff. Did you guys do data collection, or how are you creating that kind of data? SL211 and.
Yeah, I mean, you have to go to funders. And I think the solution is to I don't know, like going through the state, forcing people to report more, like not in Missouri, maybe some places, but what we've been trying to do is figure out how to partner with funders and potentially get more common indicators reported more frequently than go beyond the financial information contained within 990s. But it's an uphill climb, and I think it's kind of disturbing how little we know about the nonprofit sector and how little information is shared in a common and readily available way.
Thank you.
I have a question for Jeff that I might have missed when I was trying to take notes, but from the county shift, this feels like a big shift. What did it come from, like a particular champion in the county? Did they come from a push from the community group? Sort of how did all this get instigated?
I think a lot of the shift from the county came from just some good internal county bureaucrats, and I mean that in a very positive way. People that take the public service seriously, were not afraid of data themselves. I think also there's a different spirit of collaboration in Grand Rapids than in some other places where data is kind of seen as safe to collaborate on, especially in the healthcare arena out of the pandemic, in some ways that maybe it wasn't as compatible before. I think also just honestly, the advent of SurveyMonkey, suddenly everyone realizes how easy it is to survey, which means everyone starts to be able to more quickly recognize really bad surveys. I think that also, there's some community fatigue that played in a very positive way of, yeah, what we're doing, we could have done this in SurveyMonkey. If we're paying this much money, let's do it better. So there's a little bit of kind of a SurveyMonkey helped us.
Go ahead.
Oh, hi, Mark from Dana Haven. This is a question for Jeff also. We just finished a similar project with a very expensive random sample of 7,000, a convenient sample of about 4,000, and then the targeted sample is similar with specific groups. And my question is, when reporting results, do you have advice for how we could compare the three samples, given they're all so very different and potentially conflicting in the minds of the people, the community partners, and other organizations involved?
I'll give you a wonderfully accidental, highly scientific answer, and that is that the three different methods all actually pulled almost the same demographics. So we accidentally got a convenience sample that was almost an exact demographic match for the county. So at the end of the day, we just put the three samples together and reported them. Don't recommend that in most cases because that almost never works, and there are huge methodological reasons why that's a really bad idea most times. But in this case, we always reported the combined. We did report them out separately just in case people wanted to see, but the demographics were so very close that we could just roll them all up and talk about the almost 4,000 responses as a group instead of having to break them out separately. I've done surveys for more than 30 years. I can count on one hand the number of times that's happened. So this was a unicorn-like accident that maybe I'll see one more time in my career.
Jeff, I'm gonna keep you talking. Yeah, I'm going to keep you talking, Jeff. I really liked hearing about how you built and maintained those relationships prior to doing the survey. I think that's incredible, and we should all aspire to that. How are you thinking about maintaining those relationships into the future? How do you continue to do that work with constraints on funding and time?
Yeah, and I'll be careful here. We are essentially the hired gun. We are the vendor to this project, so the health department is who had the relationships. Fortunately, we also, from the Johnson Center, knew many of the partners because we're in the community as well. The health department is keeping that same group together on the implementation of the community health needs assessment and the community health improvement process. So that same group is actually, I think, larger in size now because kind of word is out that the health department listened, demonstrated that they could be trusted, and the community is more engaged on the implementation side. We'll see if that stays true because now, there's real money on the table, real priorities are being discussed. But so far they've maintained that momentum with the community groups. They're going on almost a third year now.
All right. Okay. Well, thank you again to all 4 of our presenters.